Crawling into his shot. You good? Thank you. Good job, Coach.
Good morning. It's a high honor and a distinct privilege to stand here today with members of the House Democratic Caucus, who I want to thank for their grit, for their strength, for their intellect, for their heart, for their soul, and for their fight on behalf of the American people. We are in this fight until we win this fight for their people. I want to thank Teresa from the great state of New Jersey, Tony from the great state, the Commonwealth of Pennsylvania, as well as Catherine from the great state of Ohio, for their presence here today, for sharing their stories, for being here on behalf of more than 300 million Americans who are having to deal with the Republican health care crisis. Mr. President, allow me to reintroduce myself. I'm the House Democratic leader. Our caucus is 217 members strong. We serve in a separate and co-equal branch of government. We don't work for you, we work for the American people. We are fighting to lower the high cost of living and to protect the health care of everyday Americans. And Mr. President, the next time you have something to say about me, don't cop out through a racist and fake AI video. When I'm back in the Oval Office, say it to my face. Say it to my face. House Democrats are here on duty, fighting on behalf of the American people, ready to fund the government in a way that lifts up their quality of life. House Democrats are on duty. House Republicans are on vacation. Shame on them for being on vacation all across the country and across the world on the eve of a government shutdown. We're on duty, they're on vacation. They're on vacation because they'd rather shut the government down than protect the health care of the American people. That's unfathomable. That's unacceptable. That's unconscionable, and that's un-American. Do your job. As opposed to being missing in action. Now we'll hear from everyday Americans whose health care has been under assault by Republicans who have enacted the largest cut to Medicaid in American history, triggered a possible $536 billion cut to Medicare because of what happened in their one big ugly bill. Hospitals, nursing homes, and community-based health clinics are closing all across America, in rural America, in urban America, in the heartland of America, and small town America, and black and brown communities all across America because of what Republicans have done in terms of this healthcare crisis that they've created. And in just a few days, notices will go out to tens of millions of Americans because of the Republican refusal to extend the Affordable Care Act tax credits, which will result in tens of millions of Americans experiencing dramatically increased premiums, co-pays, and deductibles in an environment where the cost of living is already too high. Our position is a simple one. Cancel the cuts, lower the costs, save health care. That's what this fight is all about. We're here, we're ready, we're willing and able to find a bipartisan path forward to fund the government in a way that actually meets the needs of the American people in terms of their health, their safety, and their economic well-being. But here's what we're not going to do. We're not going to support a partisan Republican spending bill that continues to gut the health care of the American people. Not now, not ever. We are here to lower the high cost of living. We're here to cancel the cuts. We're here to lower the costs. We're here to save the health care of the American people. And our promise to you, America, is that we will always stand up for what is in your best interest, to make your life better, to ensure that in this country, when you work hard and play by the rules, you can afford to live the good life for yourself, for your family, and for your children. And we know that an important part of that is protecting your health care. So we're here to protect your health care today, protect your health care tomorrow, protect your health care this week, protect your health care next week, protect your health care this month, protect your health care next month, protect your health care this year, protect your health care next year. We will protect your health care at all times and defend your health care until victory is won. My honor and privilege to now yield to the whip of the House Democratic Caucus and a champion for women, children, families, and the American people, the Honorable Catherine Clark.
Good morning. We thank Leader Jeffries. Our caucus stands with him because he is standing for the American people. And the American people are asking, is this the golden age that Donald Trump promised? Medicare about to be gutted by $500 billion with a T dollars? Nearly 20 million people about to lose their health insurance? Cuts to Medicaid that are already shutting down hospitals. Nursing homes are closing. Premiums are about to double. And the notice is go out tomorrow. Working people can't afford that. Small businesses can't stay open with costs that are exploding around them. And with all the damage that they are doing, you would think Republicans would at least show up for work. Well, we'll tell you what, Democrats are here. We're here to keep government open. We're here to keep hospitals open. We're here to keep children insured. We're here to keep health care affordable. We're here to lower costs for the American people. And Republicans may have skipped town, but you know who always shows up? Moms. Moms like our next speaker. Teresa Luoni is here to share what this fight means to her family, because moms are feeling the pain right now. Moms don't know if they'll be able to afford that next visit to the pediatrician. Moms-to-be can't even find an open maternity ward near their house. And Republicans think they should just foot the bill, $15,000 to pay for their own delivery? Moms who are horrified that 40% of the kids in this country are at risk of losing their health care. So Teresa, we thank you for being here on behalf of all moms, for showing up, for speaking out, and for sharing how these cuts will impact your two boys. Teresa.
Good morning, and thank you, Leader Jeffries, for standing with families like mine today. My name is Teresa Lalone. I'm a single mother and full-time caregiver to my twin boys, Dylan and Max, who are both profoundly autistic. For us, Medicaid is not an abstract policy or a line in a budget. It is a lifeline that makes it possible for my children to live with dignity, safety, and the chance to grow. My boys are 13. Medicaid covers the doctors, therapies, and specialists that my boys depend on. But it also helps with the most basic, essential items that families like mine could never afford without programs that the Democrats are fighting to protect. It helps pay for formula to supplement my son's restricted diet, diapers for my other son, who has not yet gained the skills to use the bathroom independently. These are not luxuries. These are everyday necessities that allow my children to survive and have some stability. And my family is not alone. Across this country, thousands of children in special education rely on these funds so they can access their education, so they can have aids, therapies, and the supports required by law to give them a fair chance in the classroom. Without Medicaid, those children would be shut out of opportunities that every child deserves. My sons are proof of what's possible when children with disabilities are given support. Max, though he is pre-verbal, has taught himself math skills and how to read using closed captions on YouTube, and he's a true tech whiz. Dylan, my nonverbal son, is one of the most empathetic souls you could ever meet, with a smile that can brighten anyone's day. He loves to help with chores, especially landscaping and gardening. With the right supports, every person has gifts to contribute to our society, and I firmly believe this. Making healthcare inaccessible to vulnerable citizens doesn't just endanger their lives, it stops their futures and the contributions they could make to our communities and our country. Disability is not something that only happens to other people. It does not discriminate. It affects people of every gender, every color, and every political affiliation. It can touch anyone at any time, whether it's a child born with autism, a neighbor who develops a serious illness, or an adult who has been in a life-altering accident. The truth is, unless you are in the very top percent of income earners in this country, no working class or poor person could possibly afford all the care that is required to survive, let alone thrive, when disability is a part of their life. That is why I'm here today. As a mother, my passion is to fight for a country where every vulnerable community, families with disabled children, seniors, people with chronic illnesses, or those living in poverty, has health coverage that is accessible and affordable. Medicaid is not charity, it is justice. It is the guarantee that we do not abandon people who need the most care. I am proud to stand here with Leader Jeffries and everyone who is working to protect and expand Medicaid, because protecting Medicaid means protecting families like mine, and protecting the very values of compassion and fairness that we say this nation stands for. And now we're going to hear from Tony.
Good morning, everyone.
Good morning.
I'd like to thank Congressman Jeffries and all the members of Congress who have given me this opportunity to travel from Pennsylvania to share my story. Again, my name is Tony Gonzalez, and I live in Indiana County, Pennsylvania with my wife and my daughter. My youngest daughter, Amber Gonzalez, is with me to help lend her daddy some strength and comfort during this time. Roughly 2 years ago, I was diagnosed with stage 4 thymic carcinoma cancer, and I'm currently being treated for the cancer and receive chemotherapy, immunotherapy, and radiation therapy regularly. Fortunately, I've been able to purchase affordable health care through the Pennsylvania State Health Insurance Coverage Marketplace called Penny to cover my cancer treatment. Right now, I have a gold plan that has a low premium, all thanks to the ACA subsidies, otherwise known as the enhanced premium tax credits. But even with this low premium and the enhanced premium tax credits, my individual out-of-pocket maximum is still $7,500. Between my wife and me, the total out-of-pocket cost is $15,000. With my cancer treatment, I end up meeting my out-of-pocket maximum every year, and the costs do add up. I'm a full-time college professor for a small college in the Pittsburgh area, but I admit with some embarrassment that I struggle to even pay most of the co-insurance as part of my out-of-pocket responsibility. My wife also has chronic illnesses and is not able to work, so we really rely on the coverage to keep us in the fight for our lives. The enhanced premium tax credits are so critical to help us afford our health coverage. Without them, our monthly premium would jump from $234 to around $450 a month, which would put us in further financial strain, and we really already break even just as it is. We want to be responsible and pay for our health care, but if premiums go up or we lose the enhanced premium tax credits, we'll have no other choice other than to drop our coverage altogether or purchase a plan with a higher deductible and out-of-pocket maximum that won't meet our needs. I hope and pray that these subsidies don't go away, because if they do, we'll be forced to compromise paying some bills and run the real risk of medical debt. I'm not the only American facing these challenges. My circumstances are not unique, and I'm not alone in this health battle. Members of Congress, I and millions of Americans implore you to extend the enhanced premium tax credits before it's too late. Thank you for your time. I now yield to Catherine for some remarks.
Good morning.
Good morning.
My name is Catherine Henderson, and I'm a surgical oncology nurse at The Ohio State University Wexner Medical Center, James Cancer Hospital. I am also proud to say that I'm a member of the Ohio Nurses Association, where I am the Health Policy Council Chair, which is an affiliate of AFT. I am here today because I can't remain silent when it comes to protecting my patients and their health. I'm here today for my colleagues, near and far, who have committed their entire careers to a cause greater than themselves. Here are the facts. This summer, Republicans in Congress and the Trump White House enacted a big, ugly law that slashed Medicaid and ended health care tax credits for working families, all to fund tax breaks for the wealthy. And the result? A full-blown health care crisis. Up to 15 million people could lose their coverage. Hospitals and clinics will be forced to close or cut essential services. And even those with insurance, like me, will face higher premiums. It could literally mean choosing health care or rent or groceries. And hospitals aren't just health care, which we all know is a fundamental right. They're economic anchors. When a hospital or clinic closes, the whole community feels it. The ripple effects, jobs disappear, schools and small businesses also suffer. The impact here is clear. If this crisis isn't resolved, these places increase burdens not only on patients, but the remaining communities to provide care where the capacity and nurses are already stretched thin. At the James, we take care of patients from across the country. Without insurance, I worry that someone's mother or father or other important family member would have to forego preventative treatment or further cancer treatments. Regardless of your political party, everyone knows that cancer doesn't discriminate and early detection is life-saving. In other words, no one will be spared from this hurt if Congress fails to act. Now we face the looming threat to shut down the government and lay off workers rather than working together to protect Americans' health care. Republicans control Congress and the White House. If the government shuts down, it's because there was a choice made. One that prioritizes politics over protecting health care and keeps our costs from rising. Our country, our patients, nurses, and families deserve stability, health care, and dignity, and we're going to fight for it. I urge Republicans to do the right thing. Work across the aisle to find a solution, one that protects health care, lowers costs, and keeps the government open. Thank you.
Good morning. Thank you so much, Catherine, for framing that discussion and ensuring that we talk about your patients, the people who you serve and see every day. Thank you, Tony, for sharing your story and being honest about the decisions that families will have to make about whether to carry forward with their health care costs, whether to pay their health premiums, or make difficult family decisions. And Teresa, thank you so much for taking care of your kids and being the anchor in the family that they need. When House Republicans passed their big ugly law, it was the biggest health care cut in the country that we have ever seen. And the fallout was immediate and it was swift. Hospitals and clinics across this country began closing. Patients started facing longer wait times and travel times. Healthcare workers began losing their jobs, and costs started to go up for everyone. At a time when Americans continue to struggle to afford everyday needs because of Donald Trump's tariffs, Republicans voted to take healthcare away to make it an expense out of reach for so many. Damage has been done, but Republicans can still change course. Republicans control the House, they control the Senate, and the White House. They could act right now to prioritize the health care of the American public. That's why Democrats are in town. That's why Democrats are here. We're ready to work in a bipartisan way to keep government open, to lower costs, and to save health care. For months, we have been sounding the alarm that the Republican healthcare crisis that has been manufactured by House Republicans needs to end. Democrats know that unless Congress acts right now to extend the Affordable Care Act tax credits, the dual health care and affordability crisis will continue to get worse. These credits make health care less expensive for millions of Americans when they otherwise wouldn't be able to afford it. Democrats are giving Republicans the opportunity to do the right thing a second chance to fix the crisis that they've created. Unfortunately, it seems Donald Trump and his Republican henchmen are hell-bent on pushing us toward a government funding shutdown, rather than saving health care for their constituents. We implore our Republican colleagues to change course, abandon that approach, put people first, cancel your vacation. Cancel your vacation. Cancel these cuts. Lower costs. Save health care. Work with us. It's what the American people want. We will continue to work to ensure that Americans have the health care that they deserve, the health care that they've been promised, the health care that they have come to expect, so they don't have to make difficult decisions that affect their families, that put their communities in jeopardy. So healthcare clinics don't close, and more hospitals don't close their doors. That's what we're fighting for. If this shutdown continues, this will be on Republicans. Republicans in the Senate, Republicans in the House, Republicans that occupy the White House. This is a shutdown they will own, and the American people are paying attention. I'm so proud to stand with our House colleagues to demand that House Republicans cancel their vacation, cancel the cuts, lower the costs, and save health care. Thank you so much.
I'm free.
Joey.
The Oregon delegation
Thank you.